Team leader of the research group, Professor Olufunke Adeyeye, said 50% of students of the schools where the research was carried out have symptoms of asthma, hence the need to call on the attention of government and all stakeholders to ensure the inclusion of the disease as part of schools' health programs.
The ministries already know that there's a challenge with the number of children with asthma, and that this is huge and it cannot be ignored. 15% of the children that were screened have symptoms that suggest asthma, 15%, and then 15%. And out of it, almost 98% of these children have actually severe symptoms. 70% of them were not controlled. The drugs either is not being used well, or is not being used regularly, or they're not using the correct medications, or they're not using it as prescribed. But anyhow, even though they had asthma, even though the doctor told them they had asthma, their control is below normal.
Representative of the Lagos State Commissioner for Health, Permanent Secretary, Ministry of Health, Dr. Olufunke Adeyeye, said the state government is ready to implement some of the recommendations made by the group.
There's a team here from our Directorate of Disease Control. We also have a Directorate of Family Health that deals with school health. So we're going to sit down with them and we're going to come up with our own actions to mitigate these things that they've said. We want to improve the detection rate of asthma amongst our students in our schools, and then we want to ensure that treatment is available for them even in school, and that at least someone in the school knows what to do when someone with asthma has an event.
Participants at the meeting also appreciate the group for further improving previous researches on asthma.
I have to admit that formerly we used to do studies on asthma and we were not looking at the influence of the stakeholders, the impact of government, and I think that was a shortfall on our end, looking back now.
There's need for the government, Nigerian government, to actually invest in research. So the government needs to, now that we're at the point of implementation, it needs to be evidence-based. We need to look at it in a programmatic way to be sure that these interventions that we've proposed, that they actually work.
So Lagos State is doing a lot, and so all these things, when they are coming in, and those NGOs, they are ready and they prepare everything. So we make our students available. Like I told you, asthma is, before now, people used to be afraid of it, that when you see just like epileptic, it was a cause and a research like this that made me to understand that epileptic is not even allergic.
Like most researches done in this part of the world ends in documentary evidences, this group says they will continue to push to ensure the implementation of the recommendations from this research work, that government and all other stakeholders will ensure that asthma treatment is being done in major schools across Lagos State. They are insisting that all stakeholders must put their hands on deck to ensure that proper medications and attention must be given to students in primary and secondary schools across Lagos State. From Lasukom in Lagos State, I am Aigboje Ikhuoria, reporting for iBrandTV.